Welcome to the Pharma Voice Editor's Take video series, filmed live at the 2013 DIA annual meeting in Boston, hosted by Taryn Grome, editor of Pharma Voice. In this session, Taryn meets with Barry Peterson, Ph.D., Senior Manager, Clinical Affairs at Philips Respironics.
Dr. Peterson, welcome to the DIA 2013 Editor's Take video program.
Thank you.
Talk to us about why assessment of sleep is so important in pain therapy studies.
Well, sleep is really important because sleep and pain are really intimately related. There are a lot of studies that have shown that people who are in pain have disturbed sleep, and that's no surprise. But there's also a lot of studies that show that people who have disturbed sleep also have increased sensitivity to pain. So it creates a really vicious cycle, and it's possible to break that cycle, but you have to identify that the problem exists.
But don't all pain therapies include sleep assessments?
No. A lot of pain studies may include a sleep assessment that's either objective or subjective, like a questionnaire, to find out the effect of the drug on a person's sleep. But not many of them actually ask the question the other way around, is what is the effect of the sleep on the person's pain level?
So you're saying that a pain therapy may not be as effective if there is an underlying sleep problem?
That's right. Later this week, on Wednesday, we're presenting a poster that shows that if you use a simple device such as actigraphy to monitor patients' sleep quality as they enter the study, in some cases you can actually predict which ones are going to respond better from the pain therapy. What we did in what's described in the poster is we took a study in which subjects were given a pain therapy for osteoarthritis. Now, the study included the subjects wearing an actigraphy device to measure activity. What we did in a retrospective analysis is use the same data to look at their sleep quality when they entered the study. And what we found was kind of interesting. Those subjects that entered the study with no sleep problems, almost every single one of them had a positive response to the drug. But those subjects, about 2/3 of them that had sleep problems, likely due to the pain, their response to the drug was some positive, some negative. So it really made a big difference.
So will this be true of all pain drugs?
Probably not, but you don't know unless you measure it. And that's why it's really important to know the sleep quality of the patients entering the trial. Because let's say you did a trial and you ignored this, and you could find an average pain response maybe in the right direction, but it's not statistically significant. But if you knew their sleep characteristics going in and you factored that into your analysis, you could find, in fact, that your drug is extremely effective as long as their underlying sleep problem is either non-existent or addressed by some other method.
Well, thank you for joining us today.
Oh, you're quite welcome.
Additional Editor's Take videos, as well as podcasts, white papers, webinars, and more, are available in the resources area at www.pharmavoice.com.